Hey class, it's Ashley Tharp, and I'm with my preceptor, Kim Pope. You all may recognize her from the last class that we were in our first clinical rotation. She was my clinical preceptor then as well, and this clinical rotation I've done time with her and another preceptor, which the video will follow with that one later. So same demographic of patients seen this second clinical rotation, and that involved addiction psychiatry or addiction medicine. And we got to see some pretty cool stuff so far these first 5 weeks.
So Ashley's done really good during this first 5 weeks of this is it semester or quarter?
It would be semester, I guess.
So she's done really well. We've been able to experience a lot of different patients. I think one experience that she'll always remember is interacting with a true psychotic patient. So that was a good experience for her. She was able to navigate how to communicate effectively to the patient who is truly psychotic while collecting the data and information she needed for her assessment. Getting to step back a little bit and let her take the lead on that, and she did really well with it. So that was a good opportunity this semester that we did have. And then
I think one of the other ones that sticks out to me was the active withdrawal on the pregnant lady that came in, and then navigating how to collaborate with the OB team and the pharmacy staff to make sure that we were offering optimal care for this mom in that acute crisis.
Which opened some more opportunities here at our facility in collaborating with those physicians and developing a protocol for a patient who is in active withdrawal who is pregnant. So Ashley actually has had the opportunity to help with that a little bit as far as research and data information regarding how to treat those patients. So, and not only that, their mental health component along with it to make sure they have the best follow-up care. So pretty neat things that she's got to experience this quarter.
So one thing that I've learned working alongside Kim this semester is just effective communication with patients and how that can differ from patient to patient interaction. So you kind of have to start, like we were talking about this truly psychotic patient, you kind of have to read the room, and you have to figure out how are you going to abstract that data from that patient the best way possible with the still keeping them calm and not feeding into that psychosis.
Which can be difficult sometimes, so.
Yes, it can be kind of time consuming. Moving on to the second question. So one thing I want to continue to develop is my assessment, diagnostic and charting skills. So throughout this clinical rotation, I've continued to build on what I had previously learned in the first clinical rotation, and I've really stepped up in and doing the assessments and the interviews and navigating through that throughout this second portion. I've tried to build my communication skills with the patients and strengthening patient education on their various diseases or conditions, and also getting myself familiar with what resources are available in our area for patients with addiction issues.
Yeah, I would say she's done really well as far as starting to look up what she was already doing in the previous semester, but really digging in deep into the DSM-5 and diagnosing these patients, looking a little deeper into their substance use disorder and what they need to follow up with, and the resources in the community, and what is the ASAM criteria that these patients need to follow up. Is it inpatient, outpatient? What type of recommendations that we're going to recommend to each patient that we see, and she's done really well with that this semester, I would say.
Thank you. All right, well, good luck to the rest of y'all, and I'll be looking for comments below. Thanks.